Hello, everyone. This is Robin Shapiro, and we will be starting the second Medical Opinions webinar in 1 minute. As we're getting started, please pull up the chat function on the right-hand side of your screen and let us know where you are listening from. Please state your state and city or country. We understand we have some European. Bonnie, nice to see you from Houston. We have some people also from Europe that should be joining us on this call. We'll get started in 1 moment. New York, New Jersey, Michigan, California. Fantastic. Great to see everyone. Okay, we're going to start. Hi, I'm Robin Shapiro, and I'm the board chair and co-founder of WASHA, the Washington State Health Advocacy Association. WASHA is a not-for-profit organization focused on helping people to transform from patient to active participant and partner in care. And we do this, our organization does this in 3 ways. 1, we seek to raise awareness about what health advocacy is. We put on meetings and webinars such as what you're viewing today to teach health advocacy skills, and we connect people with health advocacy resources. We are able to make these programs possible through the generous support of individuals, organizations, professionals, members, and partners like yourself. So we would encourage you to please learn more about WASHA by going to www.washa.org, and please join our community. We have about 1,200 people right now by signing up for our e-newsletter or becoming a member. Before we begin, I'd like to just provide you with a few reminders. First, please make sure that your microphone is on mute and will stay on mute for the whole presentation. That will make sure that the sound quality is optimal for everyone. We are recording this webinar, and so if you do not want your question visible in the chat function, which will be recorded, just go ahead and privately send the question on the side through the chat function. For all of your questions, we will be handling them through the chat function. So you will see chat at the bottom of your screen with a little chat bubble. If you click on that, you'll see that come up on the right-hand side. For questions, you can send those throughout the webinar, and then we will do a Q&A with EO at the end of her presentation, which is about 40 minutes long. If you have technical difficulties, please send those questions to Ashley Carlson either in the chat function window, or you can text her at 360-219-8852. And yes, there will be access to the recording afterwards. This question came in from Carmen. So with that, I'd like to introduce the speaker, Dolka. She is passionate about helping people obtain an accurate diagnosis and manage their complex conditions. Her drive can be traced back to her own decade-long medical struggles, going from health to bedridden and back again. She's a pioneer in the advocacy industry. She's the founder and chief care advocate of Gray Zone LLC. She is the co-founder and past executive director of WASHA, and an active member in the Society to Improve Diagnosis in Medicine Patient Engagement Committee. And I know EO quite well, and you're in for a treat today. I've seen her slides. And with that, I'd like to welcome EO. Take it away.
Well, thank you, Robin, very much. I am excited to be here, and I am excited to talk about this very important topic of second opinions. I'm going to just dive right into it because we have a lot to talk about. I am sorry I don't have a picture. It's just my voice today, but this should be fun. So here is Pamela and Jerome. We're going to talk a little bit about their firstborn son. And his name is Steve. He was 9 months old many, many years back when he got a close brush with death. Obviously, this is not a current picture of his parents. When Steve was 9 months old, he developed a fever and a pain in his belly. After a community doctor assured Pamela and Jerome that they were just overreacting first-time parents. You know, there was really nothing very wrong with this kid, and this was just a stomach bug. The baby continued actually to get worse. So much worse that within 36 hours from onset of his symptoms, they had to rush him to Children's Hospital. There, Steve was finally diagnosed correctly, which was a great thing. He had what is called an intussusception, meaning one segment of his bowel was sliding into another. Think of a stethoscope, basically. That's more or less how this goes. And it was causing an acute intestinal blockage. But the treatment the doctor suggested at 1 o'clock in the morning could have proven fatal for this baby. Steve was in an emergency and needed to be operated upon right there and then. The treating physician offered instead to watch and wait until the morning, and that could have proven fatal. Thankfully, Pamela and Jerome sought a second opinion in the middle of the night because they felt in their gut that their son was getting worse and that the doctor that examined him was actually not attentive to his needs. That second opinion saved their son's life. If they had waited until the morning, the surgeon told them that actually operated on him, Steve's gut would have erupted, potentially causing him his life. Now, some of you may have recognized that these two people are doctors Jerome Groopman and Pamela Hartzman. They're both Harvard-trained physicians, and they are now both teaching at Harvard. But what is important about this case, which is the first case that's presented in Dr. Groopman's book titled Second Opinions, some of you may have read it, is what he said, that their son lived not because they were doctors, but because they trusted their gut, that they knew their son very well, something was going wrong, the doctor was actually not paying attention to what they were saying, and they needed to do something about it. So second opinions are very important. They can save lives. So with that, let's talk more about them. What is a second opinion? How do we define it? It's a very simple thing. It's another medical opinion on your diagnosis, your treatment, or your prognosis. Prognosis basically is a forecast of the likely outcome, the likely course of your disease. That's what a prognosis means. Excuse me. Why do you need a second opinion? Well, you need it because 1 in 20 Americans are misdiagnosed each year. That means about 12 million people in the US every year get a misdiagnosis. That's quite a lot of people. 50% of these errors are potentially harmful. That means you can get anything from a disability all the way to death because you were misdiagnosed. And actually 40 to 80,000 people in this country die every year as a direct effect from a misdiagnosis. It's a staggering number, and it's a staggering problem, and a lot of people don't know about it. And we have 3 types of misdiagnosis: delayed, missed, and wrong. Delayed misdiagnosis is when enough information was available earlier, but the diagnosis was made later. In the case of a misdiagnosis, a missed misdiagnosis, what happens is information is there, but actually the diagnosis is never made. Unfortunately, this is the biggest chunk of the cases of misdiagnosis. And in the cases of wrong diagnosis, what happens is you go in with a cough, and the doctor says, well, you know, I think that's just the bug that's going around in the neighborhood these past few days, and you actually end up having pneumonia. You were given the wrong diagnosis. So, do people usually seek a second opinion? Well, there have been studies about that, and they have confirmed that since I believe the 80s, people on their own have sought second opinions, which is a good thing. And the reason why they do that usually is because they want to confirm a diagnosis or treatment that they have already been given. They are dissatisfied with the initial consultation, usually because of communication issues with the first physician. They feel that their needs were unfulfilled. They have a desire for additional information. Perhaps this is an area that the first physician doesn't know much about, so they want to get more information. They are seeking a second opinion. They hope for a change in diagnosis. Imagine that, you get a dire diagnosis. You want to see if maybe another person can give you a better diagnosis than what you got. And whether you have a risk for a major morbidity, mortality, treatment complication, or adverse effects, if you're dealing with something like this, you usually seek a second opinion. So these are cases where we know already that people go for a second opinion. And we do know that second opinions do change your care. These same studies have shown that people feel second opinions are valuable. So it's worth your time, it's worth your effort, it's worth your money to actually get them. Anywhere between 10 and 32% of second opinions yield a major change in diagnosis, treatment, or prognosis. That is pretty important. Treatment changes are more frequent out of these second opinions. Diagnostic changes do happen, but they're more challenging, and it depends on where you're going. That's a key component. In places like Mayo Clinic, like Cleveland Clinic, where there are multidisciplinary teams that do an excellent job of diagnosing, people can expect to get a completely new diagnosis in about 21% of cases, and about 66% of cases receive what's called a refined or redefined diagnosis. So it's still worth your trip, especially in places like that. Let's look about when to actually do that. Obviously, you don't need to look for a second opinion for everything. So when do you seek a second opinion? Well, there are three areas that are more crucial. What happens at your doctor's office, radiology, and pathology. Let's start, first of all, with an important point. Treatment starts with diagnosis. That's what David Newman-Tucker has talked about many times. He's a professor of neurology at Hopkins and the current president of the Society to Improve Diagnosis in Medicine. And it's important to remember that, because if you have a different diagnosis, you're going to get a different treatment. So it's important to get the diagnosis right. So let's talk about what happens in your doctor's office. When you're dealing with diagnosis or prognosis at your doctor's office, the red flags that are there for you, where you should be thinking about a second opinion, are the following. If your symptoms are without explanation, especially if they are prolonged, if you're going on for a long time and your doctor can't figure out what is happening, at some point it's time to actually look for another opinion. If you have an uncertain diagnosis or an uncertain prognosis, there is no good understanding about the course of your disease, ask somebody else what they think. In the case you're dealing with a rare or potentially fatal condition, it's extremely important in this case to talk with somebody that knows very well what is happening to you. Talk with a specialist that can tell you what to expect, that can tell you what new treatments are coming up, etc. In the case where you are getting a diagnosis that should be made by a specialist and you're getting it by a generalist, let's say your primary care physician is seeing your tremor and he says, well, I think this is basically Parkinson's disease. You should be talking to a neurologist, so it's time to go there. And if genetics are in your family and nobody is talking about how that could be playing a role with your symptoms, it's time to get a second opinion about that. Now, when it comes to treatment, the most important thing to remember here is that if you are dealing with surgery, you absolutely need to ask at least one more person, especially when this has to do with invasive surgery. The reason is that there might be another thing for you to try before going into surgery. There might be a different type of surgery to try, or there might be a different time to do surgery. So you would want to hear your options before you engage into that, except if it's an emergency situation. But actually, even more so in that case, you would need to hear from an experienced physician. If you're dealing with a dangerous or a toxic treatment, let's say you are scheduled to have chemotherapy, talk with somebody that does this for a living. Ask them again, what are your options? Should you move forward with a specific protocol? If the intervention benefits or the reasons why you should be doing this treatment or you should be having this medical device implanted are not clear to you from your consultations with your current provider, seek a second opinion. If just one or just a few treatment options are offered to you, absolutely try to find other physicians that may offer more options. Sometimes physicians are just stuck with what they know or stuck with what they do, and they forget that other things are there. But as an educated patient and as somebody who is able to select, you need to have all the deck available to you so that you can make an educated decision. And if you are in a position to enroll in clinical trials or try an experimental treatment, before you do that, speak with another professional that can help you make the decision as to the benefits and the risks of doing so. It's a great thing to do. I'm not saying don't do it. All I'm saying is be in a position to make an educated decision by talking with more than just one person about that. Excuse me. Now, the last component of that is the patient-provider relationship. And that is a very, very important piece. We rely on our relationship with our physicians. And if the communication styles differ or if there's a bad connection with them and lack of trust, we feel like we can't rely on what they tell us. So if this happens to you, you absolutely should be looking elsewhere to get a second opinion. Don't think twice about it. As Dr. Krumholz has said from Yale University, if there is any question about recommended practices, you should seek a second opinion. That's not a thing to think about. So keep that in mind. Now, how are you supposed to do that? Well, first of all, you need to collect your records. If you are an advocate or if you've ever talked to an advocate, I'm sure that they have told you you need to collect your records. And that's a very important thing to do. How you do that is pretty easy to start. If you are seen by a small office, you just call the front desk and you say, I want to collect your records. Could you tell me how to do that? And they usually tell you how you should sign a form and move forward through that. If you want your records to be sent to a physician, that's free and that's usually kind of an automatic thing to do. If you want records to be sent to you, there might be some fees involved for the process, but not an exorbitant fee. If you're dealing with a bigger practice, there are usually medical records offices, and they have very specific processes about how to do that. Again, there are forms involved about how you should do that, but there's a process that you can do and you can get your records. So get your records first of all. Then identify the right type of doctor. What type of doctor do you need for your second opinion? Most likely it's a specialist, and you're better off getting somebody who is very well trained and has better experience and better specialization than the first person. Ask friends and other providers for recommendations, especially in your area. If you are seen by an endocrinologist and you need a neurologist, ask your endocrinologist who do they know is good over there. And talk with your general practitioner. If what you need is a specialist referral, ask them who would they recommend. And if you ask all of these people and you hear a name 3 or 4 times, that's a great thing. That you really want that. That's a great thing to happen. Look for hospital affiliations and locations, especially if you're looking for a surgeon, because that makes a difference with your insurance. And of course, with how far away this is for you. Always look for board certification. This is the highest level of competency for any level of specialty. So make sure your physician is board certified. And go for an experienced provider. Experience equals performance. So the more experienced the person is, the better they're going to be. If you have a specific diagnosis, Contact a related nonprofit for preferred providers. Many times, you know, disease-specific nonprofits, they have these directories of preferred providers that they have on their websites. You know, Parkinson's disease website has Parkinson's disease related neurologists. These are great resources. Also connect with online specialized patient communities. They are powerful, they're engaged, and they're very up to date usually. And they always exchange information about who is good and who is not good in their network and in their location. So these are great places. The only thing I will say about patient communities is make sure they are positive ones. Make sure they are ones that support each other and they have something good to say. And of course, check with your insurance. Do you have a network? You know, are these physicians inside your network, or is it going to cost you a fortune to go and see them? You want to make sure you know ahead of time what's going on there. And ask a professional patient advocate. You know, these are things we do every day. So an advocate can help you research medical literature so that we can find, you know, who publishes on this specific disease and this specific subject. They can access local physician networks, check physician licenses and disciplinary actions where you are at, and do many more things. And also, you can look into online healthcare provider directories. The American Medical Association has one, healthfinder.gov has another, and many other directories are available, even specific ones like for deaf-friendly doctors. We pulled in a tremendous amount of directory links while we were doing our research. Actually, our research librarian at Grayzone did that. And we have that information to give as a handout. So make sure at the end, when Robin talks about that, you send the information that you need to send in to receive that handout if you're interested in that. So with that component, I'd like to talk a little bit about loyalty towards your doctor versus, you know, the best judgment of actually going for the second opinion. The majority of people feel pretty loyal to their doctors, and many of them don't want to upset them by seeking second opinion. However, most doctors actually welcome second opinion. So it's good to remember that, that on the one hand, we feel like, oh, you know, I'm not sure I want to do all that, but actually doctors are okay with that. And the reason is that any good doctor would like to make sure that the patient is diagnosed correctly. And they would also like to make sure that the treatment is appropriate. So the more information, the better. So keep that in mind when you're trying to decide whether you want to go for a second opinion or not. And besides, patient safety is very, very important. So you want to make sure you have the right diagnosis. You want to make sure you have the right treatment. So that concluded the section of what happens in the doctor's office. We're going to talk about pathology now. First of all, let's make some definitions. Let's give some definitions. What does a pathologist do? Not everybody really knows. So these people behind the weird microscopes, these are the pathologists, and they are medical doctors. Some people actually think that they're technicians. They're not. They're medical doctors that study body fluids and tissues, and they help make diagnosis and pinpoint effective patient treatments. And pathology actually underpins every aspect of patient care. That's very important to remember. Excuse me. Dr. Prakash, who really helped me with her interview for this section, was telling me that the actual diagnosis is made by the pathologist, not the oncologist, not the hematologist, not the primary care physician, but the pathologist. So it's very important to remember that their role is at the center of your care. And I'm going to pop a little lozenge because my mouth is getting very, very dry, and I'm going to start coughing in a moment. So I'm going to try to avoid that. So it might sound a little strange, but this is all because I'm trying to avoid coughing. Okay, so when should you go for a second pathology opinion? Because the idea here is that you're not, again, going to jump into a second opinion at every moment, right? Well, what she was suggesting to me was that when you receive as a patient, when you receive your pathology report, what you want to do is to sit down with your doctor and ask him or her, what is this diagnosis? How common is this? If you're dealing with a standard diagnosis, then there is no need, most likely, to move forward with a second opinion. If your diagnosis is a high risk or an uncommon one, then you need a second opinion. The only thing that she was suggesting is that if you ask your doctor how much you trust the pathologist first, it gives you an opportunity to talk to them. If they don't know the pathologist at all, just move forward with a second opinion. If they do know the pathologist and they trust them, then actually go forward and try to talk to the pathologist, which is something that most people would say, talk to who? I've never talked to a pathologist. I don't even know that you can talk to a pathologist. Actually, I didn't know that either, to be honest with you. And I was very surprised when she told me, and I was glad that I asked. Um, so I asked her, how do you do that? And she said, well, the first thing you do is you actually get their name and their phone number from the medical record or the bill. You know, you receive a bill at the end of the month, and if they have done your pathology report, at least there you will see their name and their number. And then you sit down and talk to them, and you ask them to explain three simple things. First of all, the certainty of their diagnosis, because that is the most important component of their report. How certain are they about the cancer diagnosis that they gave you, or about the degree of the diagnosis of the cancer, of how aggressive the cancer is, for example? What additional tests they suggest are run to pinpoint the diagnosis or do any further type of identification, what's the right treatment for you? And what are the implications of treatment from all the information that they know? One other thing to remember is that all of that interaction needs to happen sooner rather than later, because the pathologist, sat down, saw your little slide in his or her microscope, and then, a few hours later saw somebody else's. So you want to make sure that you are as close as to that encounter as you want. Don't do that 6 months later. They won't remember much, right? And if all of that thing sounds too much for you, get a friend who is a doctor or a nurse or is medically trained or a scientist coming with you, or get a professional advocate to help you with that interaction. But do that because it's going to inform you and it will inform your physician as well. What she wanted me to tell everybody is that the pathologist is your doctor. It's not your doctor's doctor, which I thought was a very good thing to keep in mind. So they are there for you to talk to. They are not just for your doctor to talk to. So don't be afraid to give them a call. And just to illustrate the effect of getting a second pathology opinion, I'd like to talk a little bit quickly about a case of a 52-year-old woman who was diagnosed with a metastatic cervical cancer. So the cancer supposedly started from her cervix, in her reproductive organs. But the treatment was not working. They had her on chemotherapy and radiation, and then when they did a follow-up exam to see whether this was working, it wasn't actually working. So she was alarmed, and she got her pathology slides examined by somebody else who said, you know what, you actually don't have cervical cancer, you have metastatic colon cancer. So she was sent to a colon cancer expert who prescribed a different chemotherapy treatment, and the patient responded well this time. So this made a huge difference. Getting, again, the right diagnosis, as Dr. Newman Tucker was saying, made all the difference in the treatment, made all the difference in the end. So it's important, it's very, very important to get it right. The last section is radiology. And I'm going to follow the same, more or less, structure here. First, let's talk about what does a radiologist do? Again, radiologists are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging procedures. And medical imaging, like pathology, constitutes a large component of the modern clinical diagnosis. In this case of radiology, I'll start off with a little bit a different side to it. I'll talk to you a little bit about how to get the most out of your initial radiology exam before I get into how you can get a second opinion, and you'll see why. Through my interviews with radiologists, became very apparent from what they told me that the most important person is the tech. This woman that has in this photograph, that has this probe holding it towards the patient's neck, actually she's doing a biopsy, I'm sorry, an ultrasound of the patient's thyroid over there. She is the tech. And this is your friend, as is the person doing your x-ray, the person doing your MRI. Excuse me. Now, you want to be involved while you're doing this or before you're doing the exam in case you cannot talk. So what they told me, what the radiologist that I talked to told me is you need to give as much information as you can to your tech performing the scan. Talk to them about your symptoms. If you're in there, if you are this woman, this patient sitting there, talk to the tech, probably not while you're doing, the thyroid scan, but talk to the tech about your symptoms. What brings you in for this scan? Talk about your family history. Does anybody in your family have thyroid cancer? Does anybody have thyroid nodules? Talk about the way you got injured. Let's say you're in there for a knee MRI or a back x-ray. What happened? How did you get injured? What they should be looking for, basically. And the reason is that oftentimes the medical record is not there or is not fully there. So the more information that the patient can bring with them, the better off the radiologist is, because they have the clinical picture. And finally, tell the tech where the rest of your medical records are located, because that way they can compare. If they have a finding now, they can go back and see, is this new, or was this always there? Is this a new nodule in your thyroid? Should they be worried, or was this always there and still the same size? No problem. So keep in mind, imaging techs are VIP, very important people. They relay the information from you to the radiologist, and the radiologist does not usually see you. When they finish the exam, they take all the information you tell them and everything that they have seen, and they go back to that dark room where the radiologist is, and they tell him or her, this is Mrs. So-and-so, and that this is what she told me, and this is her scan. And the radiologist takes all the verbal information and what they see on the screen, and they try to make a diagnosis. That's why it's very important to talk to the tech. So why does a second opinion in radiology matter? You see that lovely x-ray picture over there? I'll talk about it in a minute. First of all, a fun fact. 1 billion imaging exams annually happen worldwide. That's according to a 2015 study. That's an amazing number. We really, really use imaging for diagnosis worldwide. Unfortunately, though, 30% of all abnormal imaging findings are missed. Look at this x-ray picture. What do you see in the middle there in the spine? This is a little boy, and his x-ray shows that he swallowed a coin. I think you can see it, actually. Anybody can see it. Well, the radiologist missed it. It was part of a study. Not just one radiologist, if I remember correctly, actually a few people missed it. This is an abnormal imaging finding, and 30% of imaging findings like that are actually missed. When it comes to mammograms, about 10 to 20% of malignant tumors are missed by the first review. That's important for women to remember, A, because most women need to get mammograms after they're 50, and B, because if you do have a family history of breast cancer, that number is something that is very important to remember. You should talk with your doctor whether it's worth for you to have a second opinion almost at every time you're getting an MRI. So this was why you really need a second opinion in radiology. Now, let's talk about how you're going to get it. It's easier actually than pathology. any patient or any ordinary physician can ask for it. It can be done at the same location that you had your first exam. But be mindful a little bit of conflict, especially if it's a small institution and if it's a small practice. You know, if we are 3 radiologists in a group, and I say, hey, Mary, you know, can you review this because, you know, patient X asked for it because the first radiologist reviewed it. It's not the same thing as if your MRI is going somewhere where nobody knows you. So the radiologist I spoke to pointed this out to me. So it's better to go to a medical center, an academic medical center, excuse me, that has subspecialty radiologists or a large multi-specialty practice that has the same thing. So you want, for example, a brain specialized radiologist to see your brain MRI, right? You don't want a general radiologist to do that. So look for something like that when you're going for second opinions. And that concludes those areas that are important. And I'd like to take a few minutes to talk about the insurance coverage because that's a key part, especially here in the United States. Now, as far as insurance coverage is concerned, insurance companies are concerned, what they call a second opinion usually entails a review of records and a chat, not an exam. So you can be in a room with a physician, but what they call a second opinion is basically the opinion of the doctor about the records that you have already with you, and they're not going to examine you. Now, insurance companies have to provide these second opinions, and it depends according to your plan as to what you can do. With PPO plans, you can actually receive a much bigger level of service, let's say. You can see another specialist for a regular visit. You don't need to label this as a second opinion. So that's important to remember. And the benefits you receive will, of course, play into whatever coverage you have. So whether this person is an out-of-network is part of, depends on what type of coverage you have and the benefits you have. If you have an HMO or Kaiser Permanente type of coverage, as you probably know, you need to stay within that system. If you need to see a specialist or you need to receive treatment that's outside of that system, you probably have some options, but they are limited. If you do identify within the system someone you want to see, let's say you do your own research and you find that there's a specific person that's really good for what you have, and you want to request that you be seen by them, you can, as long as, again, this is a person within the Kaiser system. Insurance tips to keep in mind: allow at least a week for the response. 7 to 10 days is about the average. If this is an emergency situation, keep in mind that a doctor-to-doctor call can actually take place, and it requires about 72 hours turnaround time. But in general, call your insurance company. There's so many different insurance plans here. Everybody's insurance plan is different than the person's next door. So make sure that you call them first. You understand what is allowed and what is not allowed in your package, and move forward accordingly. Because I just mentioned the difference between what an insurance company identifies as a second opinion visit and the opportunity to actually sit down and be examined by another person, I would also like to point out that the in-person versus remote options. So in the in-person second opinion, like Mayo Clinic or Cleveland Clinic that I mentioned in a previous slide, where the studies show that about 20% of people have a completely new diagnosis. This is really appropriate when you're dealing with continued symptoms where people can't really figure out what's wrong with you, and you really would benefit from being seen by an expert team. Remote second opinions, they're being done by companies like Best Doctors or Grand Rounds, and now several universities have started offering it, like Stanford, where you send things in you remotely, you don't get seen, and they give you a second opinion. These are great to use for radiology and pathology, but my personal recommendation would not be to use them for anything that's really highly complex. If you want something that's straightforward, I want somebody to read my pathology report. Does this mean cancer or not? That's fine. But if you are a very complicated patient, don't use that. Go for a doctor to see you. And actually, that's what most of the doctors I spoke to for the research for this webinar told me. So in conclusion, the takeaway points I would like to point out are just a few. Remember, it's all about getting the right care for you. You are the center of your own universe. As a patient, you should be the center of this healthcare system. Should is the key word, but we're striving all to make sure that happens. Seek a second opinion for significant test results. Don't seek a second opinion, you know, if you're sneezing every now and then, but for significant test results, do that. Pathology and radiology are especially important. Any good doctor will appreciate a second opinion, so don't be afraid to seek one. Find the right specialist for your condition. Consider in-person review, as I just talked about, for complex cases. Consider remote reviews for test results. And follow up with your doctor to incorporate all information into your care plan. Many times when you go in for a second opinion, it differs from the first. What do you do in that case? Well, what you do is you go back to your doctor and you sit down and you talk about it. And that's how you move forward. Or you seek a third opinion. But basically, that's how you incorporate all of that information into your care plan. And before I move on to the Q&A, I would like to acknowledge a lot of people that really helped me put this together with interviews or with article retrieval and commentary. Most of them are colleagues from my involvement in the Society to Improve Diagnosis in Medicine. And also I'd like to point out that Julia Parker, the medical research librarian we have at Gray Zone, she did a tremendous job of pulling together articles and resources for how to find providers. So as I mentioned before, we have pulled all of these together for the handout. Please ask for it. And also if you're data hungry like we are and you want to access any of the second opinion articles that we have pulled, we're happy to share them with you. And I would like to leave this slide on while we do Q&A that says, "Fresh eyes catch mistakes." That's from Dr. Graber, the founder and president emeritus of the Society to Improve Diagnosis in Medicine. I think that's so true. And it's a good thing to just remember. And with that, I'll give it back to Robin.
Very good. Wow, that was a really terrific summary of second opinion. We have quite a few questions, and I would just like to remind everybody to type their questions either in the Q&A function, which is at the bottom of your screen, or you can also type it in the chat function, either way. So a couple questions came up during your presentation, Io. Really great job. One was about talking with your employer to see if there's any benefit or coverage on second opinion. So this comes from Michael Wood, one of our board members, and he says that sometimes there's a second opinion service at employers like Grand Rounds, Best Doctors, Consumer Medical, or Health Advocate, or Second MD. So do you have any comments on that?
Yeah, actually, thank you, Michael, for bringing this up. This is a great point. Many employer provided insurance coverages do offer that, and it's a great place to start. So you don't have to pay out of pocket. For example, Grand Rounds, if you go on your own for a second opinion, I think it's about $7,500 or $8,000 to get a second opinion for one case. Granted, they provide a significant amount of work, but you don't have to pay that. It's covered usually by your insurance company if it's a benefit that already comes with your insurance coverage. So yes, call your insurance company and ask whether that's part of your insurance coverage already. That's important. That's very important.
There were also a couple of questions that came up when you were talking about talking with the pathologist. So,
Yes,
because I think that's such an unusual strategy that most of us probably wouldn't have thought about. And
I
this one
know.
comes from, I know, this one comes from Sharon Burns, who said, will it be too late if you have to wait until you receive a bill to see the contact information for the pathologist? So if you want a more timely conversation with the pathologist, are there other strategies that you would recommend?
Well, my understanding is that, first of all, your bill will probably come in a month, probably. So that is still an okay time frame to do that. Um, if the other thing that you can do is if you receive a copy of your results sooner than that, you can still probably access the name and information of the pathologist from that report, and you can move forward with communicating with the pathologist through that report. But I think anything within a month, or maybe a month and a half, at least from my interview with Dr. Prakash, my understanding was that this was okay. It's just that, don't go 6 months later because nobody's going to remember anything, which makes
Right,
sense.
right. And Karen Isaacs also says, can you request a second opinion when you're in the hospital and they want to know if you want to sign for immediate surgery? And in your example of the patient who needed to make a middle of the night decision, Dr.
Yeah,
Grubman,
yeah.
um, how how easy is it to access the pathologist or the radiologist? Do you go through, the hospitalist there? What would be the best way to do that?
I think in the hospital is the most challenging situation.
Hmm.
And honestly, I do not have a personal experience with what happens in the hospital, but I do
Hmm.
think that this is the most challenging situation. I would say that definitely talk with the hospitalist right there,
Hmm.
and tell them that you would like a second opinion. Try to seek the most experienced person that is on call that day or is on the floor
Hmm.
for whatever specialty you're in, and ask if that person can at least um, see your case. If a pathology or radiology report is what is at stake, the good thing that happens is that most big centers, like medical centers,
Hmm.
usually have at least two people see that pathology slide or that radiology slide before they sign off of it. So that is a very important thing to remember. If you are in a hospital or in a multidisciplinary center, that's usually what happens. Um, but I think trying to speak up and making sure you do say that I really would like a second opinion. Um, you need to tell me what are my rights at this moment. Try to speak with an advocate if there is an advocate within the hospital. If they have, if the hospital has an advocate that can tell you what are the avenues to follow within this hospital to receive a second opinion. Um, I would suggest that you try to basically speak up and see what are the processes that you can follow within that hospital.
Hmm.
And of course, in my view, the best thing to do is to have an advocate you have worked with already that knows you, that you can call in at 2 a.m. and say, you know what, something happened to me and I'm in here. Come and help me. And they
Hmm.
would know much more about how they can help you and what to do. But
Yeah,
that takes a bit of a proactive step.
sure, sure. So I wanted to go back to the doctor-patient relationship and this idea about even thinking about getting a second opinion. So some of us, when we are the patient or if we're working with clients who are the patient, typically feel a little awkward about getting a second opinion. So what words or framing can you use so you are not feeling like you're telling your doctor that they're doing a bad job?
Yeah, yeah. Now, I think that's a very good question. I think most people feel kind of very uncomfortable and kind of also vulnerable, I think, at the same time, because you want to make sure that you get the best care for you. Uh, but you also want to make sure that you don't hurt the relationship. You want to come back to this relationship, right? You just want to get more information, but you want to come back to this relationship. So to me, the most important thing is to make sure you're open about this to your doctor and to involve them from the beginning in this conversation. So rather than state to them that you want to do this, involve them in the conversation and say, this diagnosis, for example, is, let's say you get a cancer diagnosis, and I think a cancer diagnosis is disturbing for anybody.
Sure.
And say, well, I am very alarmed by this, and first of all, I want to make sure that we can at least get some more information. Can we start from a second opinion, for example? I think that's a pretty benign way of putting it.
Mm-hmm.
And as I mentioned in the slideshow, most physicians would welcome it. At least that's what studies show. That's what other physicians keep telling patients and keep telling the media all the time.
Mm-hmm.
And that has been my personal experience.
Mm-hmm.
And ask them to make recommendations about where they would want to send you, and then do your own research, or do your own research first and say,
Mm-hmm.
let's start from a second opinion. And or shall we start from a second opinion? I've heard so and so is really good in this specific condition. What do you think? Do you know them? um, and just start like that, and then make sure you come back with that information. So make it a joint journey that you and me are going to go through, getting more information, and then we are going together to figure out what's best for me, the patient, to do in this case.
Yeah, I like that. And Sharon, thank you everybody for sending in your questions through the Q&A function. Sharon says, if the doctor is upset by asking for a second opinion, would that maybe be a red flag about the openness of the physician?
Yes. If I may
In a
answer very
word.
blandly, yes. Yes, it is, because as most doctors tell you, actually, they have answered this question before in previous media coverage, that this is a red flag. That yes, if they do get upset, then it's an ego thing, or then they why do they get upset? Are they afraid that somebody may have a different opinion? Any good doctor would feel that it's important to make sure, for patient safety, that diagnosis is correct, and for patient outcomes, that treatment is targeting the right thing. So no doctor who wants to be good at their job should object more information. Again, a second opinion is more information. It's not necessarily doubting the physician, is just being sure. That's all there is.
I have another question, which is a scenario for you. Let's see, two physicians disagree on ultrasound diagnostic results. Primary care physician agrees with it, and sports medicine specialist disagrees. Client doesn't want to go against her primary care's recommendation, but believes the sports specialist more than the primary care. Should she seek out a third opinion in an effort to not simply go against her primary care physician? Or maybe what's the best way to handle this? And I think you talked a little bit before about the difference in opinions when you go to a generalist versus a specialist, but if you could maybe summarize that again for this
Yeah.
particular question.
Yeah. First of all, if I understand correctly, in this case, you do have a generalist, a general practitioner, and a sports medicine physician, and
Yes.
there is some kind of injury, I assume, and there are two different radiologists that see an ultrasound in a different way, I assume, and that's what I understand. And one
I mean,
physician
yeah, I think the generalist and the specialist don't agree
on
to
what's going
whatever
on.
on
Yeah,
what's
yeah,
going on.
yeah.
So,
I
mhm,
think in any case where to the first and the second opinion, just to simplify it, the first and the
mhm,
second opinion don't agree, you can go for
mhm,
a third. I'll tell you briefly of another story I actually found funny. I'm pretty sure it's not funny. That Dr. Groupman shared another time. Dr. Groupman has published many books about
mm,
medical mistakes. And he was saying that he saw six physicians, six. Mind you, he's a Harvard doctor. I mean, he is in Harvard. That's what I mean. He
yeah.
saw six physicians for a problem he had with his hand. He received four different diagnoses. And what he took at the end was a very attentive young physician who heard exactly how he got injured. You remember I was talking about telling
Mhm,
your technician how you got injured if you're going in for, an ultrasound or an MRI, who put two and two together and gave him the right diagnosis. So you may need to see a third person. You may need to see a fourth person. I'm not saying it's fun, but the thing here is not to do what's minimal, it's to do what will get you to the right answer. And if you have two opinions that disagree, I would say see a third person, be mindful of the fact that you want to make sure that your generalist, you have a good relationship with your generalist, but that relationship is not worth more than the right diagnosis,
mhm,
because your health is worth more than anything. So
mhm.
I wouldn't jeopardize that over the relationship. Find a way to talk to your primary care and say, it's really important that we get this right. How about we get a third opinion?
Yeah. Is there anything we have just a couple more minutes, so maybe one or two more questions. The time has really gone by quickly. Are there is there such thing as too many opinions?
Well, I would guess if you go to 10 opinions or so. I honestly, I would say anything like five or so is too many. But
Mhm,
hearing Dr. Groupman saying, I
mhm,
went to six specialists before I could hear something that made sense and actually get a treatment. Um, to be frank, it alarmed me as to my preconceived bias of saying, oh, well, maybe, an X number is too many. Actually, I think the right way to approach it is if you find the right diagnosis, if you get a treatment plan that works for you, or at least has some kind of effect, then you know you're in the right path.
mhm,
If you, and that's a good, um, I think that's a good way to determine what is right. If you're still, if you're still looking, keep looking. If you need to. But if you have something that's working, don't keep looking because you don't have a reason to do that.
mhm. Right, right. So last question, again, back to the pathologist. This comes from one of our board members. How realistic is it that you can meet with a pathologist given that they don't have office hours with patients?
Well, what Dr. Prakash was actually telling me is that the easiest thing to do is to actually give them a call.
Hmm.
And they can tell you whether it's easier for them to schedule a face-to-face visit or just
Mhm,
calling them is good enough.
mhm, mhm,
Um, and the way, at least, that she talked to me about it was that, at least as far as she's concerned, and she was at Yale, so it's a multidisciplinary place. They see a lot of patients. It's not, a small office. Um, is that they would welcome that. They would welcome a patient calling into the pathology department. So a
mhm.
call should be an easy way to reach them.
Gotcha. Well, I'm sure there are more questions on the minds of folks who have participated. I want to thank everybody for participating today If you'd like to contact EO or follow up with her company Gray Zone, you can reach her at 206-900-0904 or EO, which is spelled IO, at grayzonehealth.com. Grayzone, gray is with an E. After the conclusion of this webinar, you'll see a survey which will pop up on the screen, and we kindly ask you to fill it out. It'll just take a few minutes. We really value your feedback and know that your feedback is really incorporated into what we will be hosting in the future. So if you have ideas for webinars that you'd like, please let us know. If you signed up for a CEU, you will need to fill out the survey in order to receive your CEU certificate. So if you don't have time to fill out the survey today, you'll receive an email tomorrow. It can't go out today, apparently. So tomorrow, April 5th, for you to fill out, and you have to fill out the survey in order to get your certificate. If you have any questions or are interested in joining our WASHA efforts, please visit us at www.washa.org. And we hope you'll join our community, sign up for our e-newsletter, or consider joining as a member if you haven't done that already. Thank you so much, everyone. Thank you, EO. It was really terrific, and hope to be in touch soon. And if anybody wants the handout, please email us at info@washa.org. Thanks so much.
Thank you.